constantly maintain the sound momentum of epidemic treatment. And today's theme is the epidemic treatment and control. We have with us Madam Guo Yanhong, Mr. Cui Gang from NHC, and DG Wu Yuanbing from Ministry of Science and Technology, as well as academician Wu Manqing and Dr. Wang Guiqiang from #1 Hospital affiliated to Peking University. They will answer questions related with the disease, symptoms, and the treatment. Let me first give you the updates of the epidemic. Yesterday, the 31 provinces and Xinjiang Production Construction Corp reported newly increased confirmed cases 327, new fatal cases 44, including 41 in Hubei, 2 in Beijing, and 1 from Xinjiang Production and Construction Corp, and the newly increased suspected cases 452. For increased cured and discharged cases 3,622. Close contacts removed from medical observation 10,525, and the severe cases reduced by 394. By the end of yesterday, China's mainland reported that there have been confirmed cases 39919, including 7,952 severe cases. In total, the number of cured and discharged cases 36117, fatal cases 2788, and reported confirmed cases 78824. There are suspected cases 2,308, and close contacts traced 656054, and close contacts under medical observation 65225. For Hubei, the new confirmed cases 318, including 313 from Wuhan. For cured and discharged cases 3,203, including 2,498 in Wuhan. New fatal cases 41, including 28 in Wuhan. There are confirmed cases 36829, including 30179 in Wuhan, including 7,633 severe cases, including 6,775 in Wuhan. In total, there are 26,403 cured and discharged cases, including 15,826 in Wuhan. In total, there are 2,682 fatal cases, including 2,132 in Wuhan. Confirmed cases 65914, including 48137 in Wuhan. For newly increased suspected cases 332, including 295 in Wuhan. For suspected cases 1,989, including 1,488 in Wuhan. In total, 135 confirmed cases are reported from Hong Kong, Macau, and Taiwan, including 93 from Hong Kong SAR, 10 from Macau SAR, and 32 from the Taiwan region. Excluding Hubei, other provinces had 9 confirmed cases, 120 suspected cases, and 3 fatal cases. For severe cases, the number has been dropped by 43. Excluding Hubei, and also municipalities or prefectures, excluding Wuhan, we can see the confirmed cases have dropped to single digit. Indeed, there is a sound momentum of epidemic control, but we should not slacken our efforts, and we should make every effort to prevent the further spread of the epidemic. That's all for the updates. Now we will have the Q&A. Please focus on today's theme and put up your questions. First, please identify yourself. Now the floor is open. On the front row, the second lady reporter, please. Thank you. I'm from Hong Kong Economic Tribunal, we noticed that there are some new or repeated positive cases. So how to deal with such a situation? Thank you for your question. Just as you have mentioned, indeed, there is such a phenomena with more and more cases cured and discharged. In order to be better informed of their recovery, we worked out a policy document instructing the local authorities to follow the recovered cases. And in some localities, there has been reported that those cured and discharged cases have once again found the positive results in their tests. So we are watching closely these cases and strengthened the monitoring over such cases. It has been found that these patients no longer transmit the virus back to others, and their test result is converted again to negative. So it is fair to say that the COVID-19 is an emerging and a new virus. There are a lot of unknowns concerning the pathogenesis and the development. So on the one hand, we need to strengthen the management over the cured and discharged cases. At the moment, we request 14 days of medical observation. And also, there should be strengthened follow-up and health check. Also, we have organized experts to have further studies concerning the progression of the disease. Let's continue. On the left, on the front row, the first reporter next to the aisle. Thank you. From China Daily, we noticed that the industries are resuming the operation and production. However, it is reported that the virus could have several transmission modes like droplets and etc. So what is the major transmission mode and how can the public be protected? We will have DG Wu to answer your question. Thank you for your question. This is indeed a topic of common concern. We need to make clear how the virus is transmitted, and this is an important basis for our control efforts. From the very start, we have identified the transmission mode as a key study topic. So China CDC, as well as the Chinese Academy of Medical Sciences, are entrusted to conduct the relevant studies. Just now you mentioned the droplets and contacts, as well as other potential transmission modes like fecal mouse. Our studies are being continued. Up to now, the research finds that the droplets and the contact are the two major modes of transmission. This conclusion has also been reflected in our diagnosis and treatment protocol version 6. Previously, the joint expert mission from WHO also has this conclusion.
In the process of research, some research teams have also looked at the patient's fecal specimen and found virus in their stool. That indicates that there is certain risk of fecal to oral transmission. However, the transmission capacity and conditions are yet to be further studied for confirmation. Regarding aerosol transmission, Chinese Medical Sciences Academy experimental animal study team has conducted research that certain conditions must be met. For example, closed condition. long time and high concentration of virus. These three extreme conditions must be met at the same time to have the possibility of transmission through aerosol. For ordinary people, if you are in a daily setting with very good ventilation conditions, aerosol transmission possibility is very small, almost none, or no risk of aerosol transmission in daily living conditions with good ventilation conditions. Now, epidemic prevention and control is showing good momentum, but still we are at a very critical stage. Prevention and resumption of work must be dealt with in a very orderly fashion while we keep the prevention and control of the epidemic with very good protection measures. Many media and experts have mentioned that first, in supermarkets and village fairs with very high concentration of people, we should stay vigilant, wear facial masks, and have our hands washed frequently to avoid infection in relatively enclosed conditions. In addition to strengthening personal protection, we should strengthen ventilation and have environmental disinfection and ensure that in the farm fields, in workshops with not so concentrated people, there is no need to have so strong measures. By doing so, now we can strike a balance between epidemic prevention and control and resumption of work and production. Thank you. Right-hand side, second row, the first journalist, please. Thank you, Mr. Moderator. I'm from Xinhua News Agency. Recently, with the resumption of work and the production accelerated in the country, people movement is on the rise, especially provinces with a lot of migrant workers like Jiangsu, Guangdong, and Zhejiang. People movement in these three provinces are quickly on the rise. My question is, in terms of the measures for epidemic prevention and control, do we have strengthened measures to avoid concentrated cluster of cases in these provinces with a lot of work and production activities? After work and production is resumed, people are concerned with concentrated or cluster outbreaks. Just now, DG Wu has shared with you some information on this. In light of this situation, National Health Commission has organized related departments and experts to have a dedicated thematic analysis and research according to the CPC Central Committee and State Council requirements of being science-based, precision-based, and tiered approach. Through the joint prevention and control mechanism, we jointly released a notice on further doing a good job at effective prevention and control of cluster outbreaks after resumption of work and production, making further deployments and mobilization efforts, mainly as follows. First, we ask the provinces, the different places, to ensure that before resumption of work and production, the measures, effective measures must be in place for every node of the team. Every step of the team must be in good place. In particular, 4 earlies: early detection, early reporting, early isolation, early treatment. This is the top priority among all the priorities. Second, after resumption of work and production, current measures must be concrete and implemented in a down-to-earth manner, as DG Wu has mentioned. Every day, body temperature must be measured, health must be monitored. staggered time of work, like working at home, and when eating, people should avoid eating in a concentrated fashion. Rather, they can have lunch boxes. So these concrete measures must be implemented very well. Third, in order to guide the different populations and different institutions like government agencies, public institutions, schools, department stores, babysitting, daycare centers, nursing homes, kindergartens, the National Health Commission has organized experts to formulate the different targeted prevention and control guidelines for different types of institutions and places. We have provided these guidelines to the Joint Prevention and Control Mechanism, and we have also uploaded these guidelines onto our official website so that people can get the information in a timely fashion. Fourthly, the speaker corrected himself. Once we found that there is a suspected case, like an employee of a certain institution, it must be reported in a timely fashion immediately and cooperate with the related authorities for prevention, including isolation, epidemiology survey, and disinfection, sterilization, etc., a whole set of measures. And finally, for employees of government agencies, public institutions, and enterprises, we need to have strengthened outreach program and education program for them. The employees have the obligation to cooperate with their employer organizations, and we all have to raise our awareness of prevention and control. We must have very good self-protection. All these measures need to be implemented very well. Thank you. The floor is open for questions again. Right, the third row, the gentleman journalist there. I'm from Phoenix TV. For COVID-19 convalescent treatment, now it is showing its effect. First group of patients have been discharged. I would like to know the health conditions of the first patients receiving convalescent therapy, and is it applicable to all the severe and critical cases? I would like to ask Madam Guo Yanhong to answer the question. Now, a lot of clinical trials and clinical practices have shown that the convalescence of COVID-19 through the specific antibodies can neutralize the novel coronavirus. Therefore, in the process of convalescent therapy, we have seen very good efficacy and safety. The efficacy and safety has been generally accepted. In progressing with convalescent therapy, we have formulated the treatment and diagnosis and treatment protocol in terms of the enrollment of convalescents, collection and preparation of plasma, and the indication of treatment. We have written the guidelines. Up to now, we have collected the plasma of 544 person times that have been used for the treatment of 245 patients. In the process of clinical treatment of these patients, for more than 48 hours, totally 157 patients were monitored for more than 48 hours, and 91 of them, in terms of the clinical indicators and symptoms, have had improvements. In order to further guide and standardize convalescent therapy at the national level, we have established an expert panel, which is responsible for continuous improvement of the diagnosis and treatment protocol, and which has strengthened the monitoring and analysis of the cases. At the provincial level, we have also established a provincial level expert panel.
The provincial expert team is responsible for the full process quality. It is fair to say that clinically, the convalescent plasma has shown some effects, and together with the relevant authorities, we are working on policies to encourage the cured and recovered patients or people to donate their plasma so that more severe and critical patients can have the hope of recovery. For convalescent plasma treatment, Dr. Wang, could you please make more additions? Okay, just as Madam Guo has mentioned, the convalescent plasma treatment is an important therapy among the various therapies. Previous efforts have proven that there is a neutralized antibody in the convalescent plasma. So we suggest to test the neutralized antibody in the convalescent plasma to make it as a therapy. Also, as Madam Guo has pointed out, we now have more and more cured and discharged people. We hope that these people can donate their plasma, because throughout the country, the current collection of convalescent plasma is just more than 500 copies, and we hope more people can take the initiative and donate their plasma to contribute to the treatment of the disease and also to reduce the fatality rate. Okay, let's continue. On the left, on the third row, the reporter in black. Thank you. From Guangming Daily. We found that some high-tech products are broadly used. Could you please share with us information technologies like big data and artificial intelligence? What's their role in the epidemic control? Academician Wu Manqing, please. We are earnestly implementing the important guidance of President Xi Jinping. Big data is adopted to support the epidemic containment. Previously, there are telecom communication companies and IT companies have focused on the key provinces, especially the key time points, to get the information about the personnel flow. Also, there has been an information platform established to analyze the potential spread and development of the epidemic. And actually, for people, if you put in the identification number, you will be able to be informed by this platform whether you are a close contact. Also, the Chinese Research Institute of Information Technology has set up an information platform to make the sound coordination of the relevant data and information. And also, we have ut.com and other companies have developed information technology products like the infrared monitors to collect information and increase the monitoring efficiency. Furthermore, internet companies have developed artificial intelligence products to facilitate diagnosis. In general, the big data technology has contributed a lot to the epidemic control. Yesterday, the CCTV.net developed a video clip. It's about a drone who is utilized to deliver goods and products to specific localities. with a non-contact approach. Also, some of the internet companies have developed and contributed the calculation capacity to facilitate the drug and vaccine R&D. I know people are also very interested in the source tracing of the virus. Indeed, in this aspect, big data is contributing its role. At the moment, we are using the big data to facilitate the work resumption, mainly to facilitate the personnel flow or the transportation of the supplies. We wish to make these efforts more detailed and more tailor-made to implement the work resumption. Of course, in this process, we also run into difficulties like data sharing difficulty or obstacles. But we have seen the big potential of big data application. And I think for the next step, the big data and AI will continue their contributions to the epidemic containment and control. In the longer term, I think we will focus on the development of public health system. Okay, thank you. Let's continue. On the left, on the third row, the second journalist, please. Thank you. From Chinese Medicine Tribunal, it is instructed that we should prioritize both the treatment of the mild cases and the severe cases. However, it is found that some mild cases can quickly develop into severe cases. So, are there any effective ways to prevent the deterioration or worsening of the symptoms? Madam Guo, please. Thank you. Yes, indeed. In the treatment, the treatment of the mild cases is extremely important. We recommend to have early intervention. On the one hand, we emphasize the early treatment of the mild cases, and also, on the other hand, make every effort to prevent the progression from mild cases to severe cases. So, first, we are implementing the 4 earlies. In implementing the 4 earlies, we are aimed to identify and test the potential case so that the patients can get the early intervention. So, on the one hand, to have early diagnosis and treatment, and on the other hand, to prevent the potential spread of the epidemic in the families or in the communities, and also early diagnosis and treatment can increase the outcome, improve the outcome of treatment. Also, for cases developed into severe cases, we are also monitoring such progression very closely, and experts are organized to work out treatment guidances. So, in the process of disease progression, by monitoring the clinical indicators, early intervention should be adopted to greatly reduce the potential worsening of the symptoms and the disease progression so as to increase the cure rate. Also,
in Wuhan and Hubei province, based on the summary of the experience of treatment of mild cases there, we have released the treatment protocol, diagnosis and treatment protocol for mild and ordinary cases of novel coronavirus for standardized treatment based on the guideline, which has greatly increased the cure rate and reduced the fatality rate. Thank you. Now, right, the fourth row, the gentleman, the journalist in blue, please. I'm from China Media Group. I have a question related to the drugs clinical trial. Recently, medium coverage says, since the outbreak, more than 200 clinical trials have been registered. Most of them are about drugs. But according to knowledge, only 5 drugs have the qualifications for conducting clinical trials, but more than 70 drugs are conducting clinical trials. I know that in some hospitals in Wuhan, there are not enough patients clinically, so people are competing for patients. We are seeking very effective drug therapy, but will such clinical trials interrupt or the process of clinical trials? And about the new use of old drugs, how are the clinical trials being conducted? I would like to ask Mr. Wu Yanbing to answer the question. Since the outbreak, many medical institutions are starting to conduct research on drugs to choose efficacious drugs for clinical treatment. According to preliminary statistics, in the Center for Registration of Clinical Trials, about 234 clinical trials were registered. And for those that are drugs clinical trials, the number is 105. There are also some related to diagnostics, etc. In terms of the drugs, there are traditional Chinese medicine, chemical drugs, and biological drugs. Most of the drugs are already marketed drugs. As the journalist has mentioned, the new use of old drugs, which can, to a certain extent, guarantee safety. As the journalists have mentioned, if there are too many clinical trials, there might be a waste of resources. Even the clinical trials, the huge number of clinical trials may affect the treatment of patients. Therefore, while working on the research, we're also organizing the resources to ensure that we can identify efficacious drugs in a science-based manner. Therefore, National Health Commission, Ministry of Science and Technology, National Medical Products Administration have worked together to have formulated a document on standardizing the clinical trials, on regulating clinical trials related to the treatment of COVID-19. In that document, in that notice, the following aspects are emphasized. First of all, it specified the conditions for conducting clinical trials. That is to say, the drug should be already marketed drug that have undergone in vitro trials or animal studies that have confirmed the efficacy. And the clinical trial site should be at least a county-level designated hospital, including mobile cabin hospital or hospitals. And for the investigators, there are also qualifications requirement. That is to say, at least it should be a physician holding deputy senior technical title to have very good control of the procedures of the clinical trial. Thirdly, it further specifies the procedure. The hospitals and investigators of the clinical trials should follow the requirements of the administrative measures on clinical trials of drugs to have ethics review and have whole process of quality assurance and risk control. Accordingly, the corresponding health and other related authorities should also collect information on clinical trials that have been conducted or about to be conducted by medical institutions or research institutions. Such information should be submitted to the Scientific Research Task Force, which will then make recommendations on clinical trials of drugs and release information on drugs clinical trial to have overall organization and mobilization of the resources to increase the effectiveness. Research is designed to be used. So the task force will recommend the drugs that are very efficacious to the Joint Prevention and Control Mechanisms Medical Rescue Subteam to study whether the use scope should be expanded or should be incorporated into the diagnosis and treatment protocol. For example, convalescent therapy mentioned just now was recommended by that team and then incorporated into the diagnosis and treatment protocol. In version 6 of the protocol, chloroquine phosphate was also incorporated into the protocol based on the trials and studies and recommendations. In the future, through science-based, highly orderly clinical trials, we'll be able to screen more drugs that are efficacious and safe. Thank you. Right-hand side, fourth row, the first journalist, please. Thank you, Mr. Moderator. I'm from Beijing Media Group. In places other than Hubei, the new cases number has come to a single digit, but now there are people going to scenic spots. So some experts said that for zero growth, places should be observed for another 28 days before we can rest assured. I have a question. Why should we have another 28 days for observation, and when can we get back to normal life? Thank you. I would like to ask Mr. Cui to answer the question. Thank you for your question. This is a question of great concern to every person of the society. Just now, Mr. Mi Feng shared with you the updated information on epidemic prevention and control across the country. You can see in recent days, the numbers of the epidemic and the overall situation of epidemic prevention and control. Overall, the situation is getting better and better. Also, however, in Wuhan, in Hubei province, the situation is still a daunting challenge for us. For other provinces other than Hubei, we should consolidate the achievements already made, and at the same time, we need to avoid the epidemic coming back. That is to say, across the country, at the national level, before the epidemic is completely controlled, we should resolutely follow the instructions of the CPC Central Committee and the State Council to have science-based and precise prevention and control, to have different zoning and different layers of approaches for epidemic prevention and control. High, medium, and risk levels are the three levels based on which we should have differentiated, layered prevention and control measures. For low-risk areas, we can have comprehensive resumption of work and life. In medium-risk places, in light of the situation of epidemic prevention and control, we should gradually resume normal work and life in an orderly fashion. For high-risk places, currently the top priority is to implement various prevention and control measures in a down-to-earth manner. So, categorized and layered approaches. The phenomenon mentioned just now was only sporadic. This novel coronavirus or COVID-19 disease is a respiratory disease, and the whole population is susceptible to the disease. I recommend that we do not. I recommend that we stay vigilant and continue with the good prevention and control measures.
Let's continue the Q&A on the left, on the fourth row, from China News Service. Some experts show that in the media that the epidemic is indeed a self-limiting disease. However, compared with the conventional self-limiting disease, the epidemic has already claimed a lot of lives and patients. So could you please elaborate on this epidemic? Okay, now Professor Wang, to answer your question. Well, self-limiting disease does not mean that you don't need a treatment or it will quickly recover. For self-limiting disease, it refers to acute diseases that will have no severe or no sequelae in your sera, and it will not become a chronic disease. Also, for self-limiting diseases, the majority of the patients do not need treatment before they get recovered. For the COVID-19, you can see that this virus may claim lives, especially for the senior and vulnerable population with underlying diseases. And there are some mild cases which may rapidly develop into severe cases. We are not clear about the reason behind such rapid progression. This might be related to the cytokine storm. So we emphasize that there should always be alert, and just as Madam Guo has mentioned, we should have early intervention. So for COVID-19 patients, we suggest to have early detection and medical intervention. In some media, the self-limiting term is misunderstood. So I hope to eliminate such misunderstandings, and it's necessary to correct the misunderstanding. The timely treatment is really necessary. It also means the timely quarantine and seeking medical advice or treatment. Thank you. Thank you. Due to the time constraint, one last question, please. Let's continue. One last question on the left, on the fifth row, the reporter close to the aisle. From Dragon TV. NHC published data indicating that there are more than 36,000 cured and discharged cases. So what about the major feature of the virus, and anything to promote, any knowledge to promote? Thank you for your question. Just as you have mentioned, we now have 36,000 cured and discharged cases. They represent 45.9% of the confirmed cases. We've also strengthened the analysis concerning the recovered patients. We have already analyzed more than 8,400 medical records of these people, and we find that the proportion of mild and common cases is 90.8%. For severe cases, 7.2%, and the critically ill cases is only about 2%, more than 2%. For the mild cases, the average age is 43 years old, and for the severe and critically ill cases, the average age is 53 years old. In terms of the complications, among the 8,000 plus cases, 1,133 or 33.5% of the cases have one underlying disease, and 2.8% of the cases have more than one complications or underlying diseases. This indicates that for severe and critical cases, with timely interventions, we have the capacity to cure them. In terms of the diagnostic and treatment approaches, antiviral treatment represents over 85%. Also, it is gratifying to see that close to 40% of the patients received the integrated treatment of Western and TCM. For milder cases, we have the supportive therapies and also the symptom treatment as well as nutrition support. For severe cases, the more comprehensive and multidisciplinary therapies and treatment are adopted. In the treatment, we pay particular attention to the support to the respiratory function, the organ function, and circulation function, and also the prevention of complications and active treatment of the underlying disease and the prevention of the secondary infections. So, by summarizing the experience, I'm confident that the effective treatment approaches and experience will be adopted in improving the diagnostic and treatment protocol to improve the national performance. Okay, that's all for today's Q&A. We will have Professor Wang Guiqiang to give us the health knowledge. Okay, two questions. One is, what is a cluster case? For cluster outbreak, this is an important term in epidemiology, especially in the epidemiological surveys or monitors. We use this term to study the risk of outbreak. For the cluster outbreak, in this epidemic, it emphasizes that within 2 weeks, there are more than two cases within a family or a company. So for such patients, we need to follow very closely, and if there are clinical symptoms developed, then we should have the nucleic acid test. So we have a fairly sound system to monitor the potential cluster outbreak. We have the sentinel points, and also we have a corresponding monitoring system for the various symptoms. The second question is any medicines to improve immunity and prevent infection? Well, for any infection, if the human body has adequate immunity, then it will be possible to prevent the infection. We have the natural infection, and also we can have the secondary immunity. For natural immunity, this refers to our skin or any other immune organs, and such a natural immunity is like a guard or a sentinel, and it has a natural elimination system to prevent the potential infection. So this is regarded as the frontline defense. If the the natural immunity is not able to guard against the infection, then we will have the specific immunity.
In this process, a disease may occur and progress. Therefore, strengthen the immune system, keep your immunology to guard against the virus is very important. However, now there are no specific drugs that can strengthen our immune system. We emphasize balanced diet, physical activities, and good psychology status, which are very important for our immune system. I hope that the general public should not take the functional food which may have damage to your body. I hope that you can have balanced diet, very good psychological state, and physical exercises to keep healthy. Thank you, all the panelists. Next, tomorrow we'll focus on the treatment and treatment of COVID-19 patients and